Meet Carol and Jim from Michigan. They've been on Medicare for 6 years. They pay their Part B premium every single month. That's over $2,000 a year just for Part B. But here's what they didn't know. Medicare gives them more than 20 free preventative services every year. No copay, no deductible, $0 out of pocket. Carol and Jim have never used a single one. They're not alone. Research shows that roughly half of all Medicare beneficiaries skip the most valuable free benefit available to them. It's called the annual wellness visit, and it could be worth over $1,000 in free services every year. By the end of this video, you'll know exactly what Medicare covers for free. You'll know the one myth that tricks people into getting a surprise bill, and you'll know the 3 words to say when you call your doctor's office that unlock everything. And the part most people miss is there are actually 2 free visits, not 1. The first one expires, and most people don't even know it exists. Quick note before we dive in. I'm not a financial advisor or a government employee. Everything in this video is for educational purposes only. For your specific situation, always check with a qualified professional. Let's get into it. 2 free visits, 1 deadline you can't miss. So now you know there's money on the table, but here's where it gets specific. Medicare gives you 2 separate free visits. They sound similar, they are not the same. And one of them has a deadline that catches almost everyone off guard. Visit 1, the Welcome to Medicare visit. The moment you enroll in Medicare Part B, a clock starts ticking. You have exactly 12 months to schedule what's called the Welcome to Medicare visit. This is a one-time benefit. Use it or lose it. Here's what it includes: a full review of your medical history, a vision test, depression screening, a fall risk evaluation, guidance on advance directives, and a personalized prevention plan built just for you. The Part B deductible does not apply. You pay nothing. But here's the catch. If those 12 months pass and you haven't scheduled it, this benefit disappears forever. You can never get it back. And studies show barely 1 in 8 new enrollees ever use it. Think about that. A free visit designed specifically for new enrollees, gone before most people know it exists. Visit 2, the annual wellness visit. After your first 12 months on Part B, you become eligible for the annual wellness visit. This one doesn't expire. You can use it every year for the rest of your life, and it costs $0. The annual wellness visit includes a cognitive assessment for early signs of memory problems, a health risk assessment, a review of your functional abilities, fall risk screening, a complete medication review, and an updated personalized prevention plan. This visit is a strategic health planning session. It's not a checkup, it's not a physical. And that difference matters more than you think. But before I explain why, let me show you the full list of free screenings that the wellness visit helps you access. When you see what's available, you'll understand why skipping it is like throwing away a paycheck.
The free screening list that's worth more than you think. Most people think Medicare covers doctor visits and hospital stays. That's true, but it also covers a long list of preventative screenings at $0 cost. No deductible, no copay, nothing. And these aren't small ticket items. Let me walk you through the big ones. Screening colonoscopy, covered every 10 years for average risk, every 2 years if you're high risk. If you paid for this out of pocket, it would cost you anywhere from $1,200 to nearly $5,000. Under Medicare, it's free. Annual mammogram, covered every 12 months for women age 40 and older. Market price without insurance, $200 to $400. Under Medicare, free. Lung cancer screening with a low-dose CT scan, covered annually for adults age 50 to 77 with a 20-plus pack-year smoking history. Out of pocket, that's $200 to $300. Under Medicare, free. Cardiovascular blood tests, covered every 5 years. Diabetes screening, covered twice a year if you're at risk. Bone density scan, covered every 2 years. Prostate screening, glaucoma tests, depression screening, alcohol misuse counseling, all free. And here's something a lot of people missed. Thanks to the Inflation Reduction Act, every recommended vaccine under Medicare Part D is now free. That includes shingles. That includes Tdap. Since that change took effect, shingles vaccination jumped 42%. That's a $400 vaccine series you're now getting at $0 cost. And there's more. Medicare covers tobacco cessation counseling, up to 8 sessions a year, obesity counseling for anyone with a BMI over 30, medical nutrition therapy for diabetes and kidney disease. These services add up fast. Add it all up, in a year when you're due for a colonoscopy, a mammogram, a flu shot, and your recommended screenings, the total market value can reach $3,000 to $4,000. Even in a routine year, the value easily tops $500. The title of this video says $1,000 in free services. That's actually conservative. So why do so many people miss all of this? The answer comes down to one myth, and it's the one that costs retirees real money. The myth that triggers a surprise bill. Here's the myth. My annual physical covers everything the wellness visit does. Here's the truth. Medicare does not cover an annual physical exam under Original Medicare, period. Let me say that again. If you call your doctor and ask for a physical, that is not the same as the free annual wellness visit. The wellness visit is a planning session. There's no stethoscope, no blood draw, no hands-on exam. Your doctor reviews your risks, checks your medications, screens for cognitive decline, and builds a prevention plan for the year ahead. A physical exam, on the other hand, involves diagnosing and treating medical issues. That gets billed as a standard office visit, and that bill hits your deductible. This is how surprise bills happen. Someone walks in thinking they're getting a free visit. The doctor starts treating a problem, the billing code changes, and suddenly there's a $200 charge they never expected. The fix is simple. When you call to schedule, use these exact words. I'd like to schedule my annual wellness visit. Those 5 words matter. They tell the office exactly which billing code to use, and they protect you from a surprise charge. Now here's the good news. You can combine both visits on the same day. You can have your free wellness visit and also address a medical concern. The wellness portion stays free. The problem-focused portion gets billed separately under its own code. If you have a Medicare Advantage plan, you're covered too. Every MA plan is legally required to offer the same free preventative services as Original Medicare. Many plans add extra benefits on top, like free dental and vision. Before I show you the next part, I want to hear from you. Drop a comment right now. Have you ever scheduled an annual wellness visit, or is this the first time you're hearing about it? I read every single comment, and I'm curious how many of you already knew about this. Now, you know what's free. You know the myth to avoid. But here's the question nobody asks. Does using these free services actually save you money down the road? The research says yes, and the number might surprise you.
The math, how free visits protect your portfolio. A peer-reviewed study published in the American Journal of Managed Care looked at what happens after people start using the annual wellness visit. The researchers tracked nearly 8,000 Medicare beneficiaries across 44 clinics. What they found was striking. Total healthcare costs dropped by 5.7% in the year after the first wellness visit. That's roughly $400 to $450 per person per year. Where did the savings come from? Fewer emergency room visits, fewer hospital stays, problems caught early before they became expensive. Now let's make this personal. Let's go back to Carol and Jim. They pay about $6,000 a year in total Medicare premiums, Part B, Part D, and their supplement plan combined. That money's already spent. It's gone whether they use their benefits or not. If they skip their free preventive services, they're more likely to face a health surprise down the road, an undetected heart condition, a late-stage cancer diagnosis, a fall that leads to surgery. Each of those events can cost tens of thousands of dollars, and those costs come straight out of the savings and the investment income that funds their retirement. But if Carol and Jim use their wellness visit every year, they get screenings scheduled on time, problems caught early, a prevention plan that keeps them ahead of the curve. And based on the research, they could save $400 or more every single year in avoided costs. Over 10 years, that adds up. $4,000 or more staying in their account instead of going to a hospital billing department. That's real money. That's dividend income protected. For anyone living on dividend income, that math matters. Every dollar lost to an avoidable medical bill is a dollar that should have stayed invested, generating income, compounding. You already paid the premium. The only thing left to do is use it. That's the dividend hustle philosophy. Maximize every dollar in your portfolio and in the benefits you've already paid for. Your Monday morning action plan. So now you know what's free. You know the myth to avoid. You know the math. The only thing left is what to do about it. Here are 3 things you can do this week. Number 1, call your doctor's office and say these exact words. I'd like to schedule my annual wellness visit. Don't say physical. Don't say checkup. Say annual wellness visit. Those words trigger the right billing code and keep your cost at 0. Number 2, ask which preventive screenings you're due for based on your age and risk factors. Your doctor should have this information from your last visit. If you've never had a wellness visit, this is where the personalized prevention plan gets built. Number 3, if you enrolled in Medicare Part B within the last 12 months and you haven't had your Welcome to Medicare visit yet, schedule it now before the window closes. Once those 12 months are up, this benefit is gone for good. One more thing. Bring a list of every medication you take, prescription and over-the-counter. Your doctor needs that for the medication review, and it could flag interactions you don't know about. These are free Medicare preventive services you are already paying for. The annual wellness visit utilization rates in this country are still far too low. You don't have to be part of that statistic. If someone you know is on Medicare and might not know about these free benefits, share this video with them right now. It could save them real money and real headaches. Now I want to hear from you. What free Medicare service surprised you the most? Was it the colonoscopy? The vaccines? The fact that Medicare doesn't cover a physical? Drop your answer in the comments. I read every one. And if you're building retirement income and want to stay ahead of changes like this, subscribe to this channel. I cover everything that protects your income, your benefits, and your future. Next week, I'm breaking down the Medicare costs that catch retirees off guard in 2026 and exactly how to plan for them. You don't want to miss that one. I'll see you in the next video.